basic strategies for stroke prevention.
Wow, so much learning took place tonight. Hope you make the next meeting.
We're here at the Life meeting, and we're just talking about dementia, Alzheimer's disease. Can you just sort of summarize what it is and what are the things that we can do about it?
Well, I think the thing that we learned tonight is that Alzheimer's disease changes are almost inevitable in most of us as we get older, but that on their own, they don't necessarily result in dementia. That Alzheimer's disease changes in the brain often require stroke changes in the brain as well to really exert their full influence. And so the smartest strategy to prevent dementia is actually to prevent strokes, and we know how to do that very well through optimization of our vascular health. So keeping our blood pressure low, tackling diabetes, low cholesterol, and quitting smoking, and maintaining, above all, physical activity. And so if we engage in those activities, then we'll have a less likely chance of developing strokes and thereby a less likely chance of developing dementia, whether from Alzheimer's or some other source.
What happens if you have atrial fibrillation?
So with atrial fibrillation, we often need medications that are stronger than just aspirin to prevent the risk of stroke. And so there are all kinds of new blood thinners on the market that we can take that will substantially reduce our risk of stroke. At the same time, not with significant bleeding complications or risks.
And people have these brain games on the internet. What's your thoughts about those?
So most of my colleagues will maintain that learning how to do these brain games, you get a lot better at the games, but that doesn't necessarily prevent dementia. Exercise, physical exercise, these are all ways that you can lower your blood pressure without medications, and they're all very effective. So your blood pressure should be as low as it can be without being dizzy. So I think a normal blood pressure is about 120 over 80. We know that the higher your blood pressure is, the more likely you're to have heart attacks and strokes. I do two things. One thing is I always ignore the first number because it's the resting blood pressure that we're interested in. Your blood pressure is going up and down all day. So if you're running around looking for groceries and then you sit down and stick your arm in one of these things, the cholesterol could be rock bottom. And the reason you want your cholesterol to be rock bottom is you want to reverse some of the hardening of the arteries. In fact, I went to a talk by Eva, and the top one, donepezil, is the one that I typically use because it's the easiest to prescribe. It's just 2 doses, 5 or 10 milligrams. The patient doesn't really notice very much, but if the person is still living with their family, when they come back a couple of months later, they're like, oh my God, they're like, so are they going to move out of the house? Are they going to, let's rethink more than aspirin if you have atrial fibrillation, and surgery to clean the arteries in the small percentage of people that require stronger blood thinners, traditionally Coumadin or warfarin, but there are many newer, stronger blood thinners.
Well, we learned a lot today. What I realize is if you make it to 65 years of age, you have a 1 in 25 chance of having Alzheimer's disease. To 85, is it 1 in 3?
1 in 3.
Above 85.
Above 85.
Yeah.
All right. Well, listen, I'm going to grow old and healthy, and I'm going to go for a walk tonight. Thank you so much.
You're welcome.